Joining us today to lead off our program is Dr. Michael Lauer, an interventional cardiologist and the director of the MidMichigan Health STEMI Program. Doctor, welcome to Community Focus.
Thanks for having me.
Now, what does the acronym STEMI, S-T-E-M-I, mean?
So it stands for ST elevation myocardial infarction. A myocardial infarction is medical jargon, if you will, for a heart attack, which occurs when there's sudden damage to the heart muscle from a sudden lack of blood flow, when a blood clot forms on top of cholesterol in the artery, causing damage downstream. An ST elevation myocardial infarction or heart attack is a type of heart attack which is apparent on the EKG, done either in the emergency room or by EMS personnel, which in a patient with symptoms compatible with a heart attack almost always indicates that indeed a heart attack is occurring and the artery is closed and is a time-intensive, a time-sensitive issue to get the artery open to stop the heart attack.
You know, you said in conjunction with some of the symptoms, or even classic symptoms, what are some of those symptoms that a person should be aware of?
Right. Many people think, and classically we think of a heart attack having symptoms of chest pain or chest pressure, which often is present, although sometimes can just be described as a pressure or heaviness, sometimes feels very much like indigestion, and it can be either accompanied by or by, say, sudden sweating, what we call diaphoresis, breaking down in a sweat for no good reason, or nausea, some shortness of breath, feeling of your heart pounding, or some impending doom. And actually, some patients, up to 20% of patients, a little more in women and diabetics, but can occur in non-diabetic men as well, can have those other atypical symptoms of just breaking out in a sweat or shortness of breath without chest pain. So we always, part of our mission to educate the public is to be aware for any sudden symptoms such as I spoke of that might be indicating that you or family members having a heart attack.
Now, what's novel about the regional STEMI program?
So this program, which basically empowers the emergency medical services, the EMTs, paramedics, that come into the home in somebody who's having symptoms that might be compatible with chest pain. They perform an EKG and they make the diagnosis, and they actually immediately put into play the process to stop the heart attack by bringing the patient directly to our what we call cardiac catheterization lab, which is the procedure room where we can open the artery that's totally closed with a balloon, usually put in a stent to open up the artery and stop the heart attack. In the past, patients would either come to the emergency room or paramedics would pick up the patient, take them to the emergency room. The emergency room physician would interpret the EKG, call the cardiologist, and if it's on the nights or weekends, have the team come in from home. So this could be a several-hour process to come in and stop the heart attack. This program, which is similar in some ways to programs all across the country, but our program we're particularly proud of is somewhat unique in empowering the paramedics to make the diagnosis. Partly because we have a large area, some of which has no cell phone coverage, and so not being able to transmit an EKG, we've put in a training program where all the paramedics in our surrounding counties, not only the MidMichigan Health Emergency Medical Services, but the surrounding counties and other health systems who we participate in, go through yearly training and testing. And this has been shown to increase the or shorten the time to opening the artery, which will, in the long term, decrease mortality and increase the likelihood of minimal heart damage.
So the EMTs, when they arrive on site, can administer an EKG at that point and use that EKG to do the actual diagnosis and start the process so that when the patient gets to the lab, there are people there ready to perform whatever procedures are necessary.
That's exactly correct. It's not too unusual to perform the EKG, but to have them trained and to make the diagnosis and essentially bypass the emergency room when the diagnosis is clear based on the symptoms that assay received from the patient and the EKG. So we completely bypass the emergency room and go straight to the suite where we can actually stop the heart attack and hopefully save the life.
So what we want to do is educate the public that if you have symptoms, what should you do? What is the first thing or the thing that should be foremost in your mind if you have symptoms, what you believe may be a heart attack?
Exactly. First, sit down, summon a family member, but then to call 911. Many patients are somewhat hesitant to do so. They say, well, I only live 5 minutes away, or I don't want to bother or alert the neighbors or what have you. But it's very imperative. First of all, although a heart attack begins with these subtle symptoms, it can become fairly catastrophic. It can lead to cardiac arrest and have the patient pass out or even drop dead. And so you certainly don't want that to happen while en route to the hospital. But what's unique with this program is because the process can be put in place in the home, it can shave off 30 minutes while you're driving to the emergency room or while the EMS is taking the patient to the emergency room. I and the Cath Lab team, or one of my partners, is already on the way in and preparing. And so it's very important so we give the heads up so we can start the treatment process even before you arrive to the hospital.
So call 911, don't go to the emergency department on your own, wait for the EMTs to arrive. Now, the STEMI program has been in place here for a relatively short time.
Correct. About 2007, actually, is when we first started doing open heart surgery and angioplasties and stent here in Midland. About the same time, a national effort by the American Heart Association called Mission Lifeline was helping programs like MidMichigan's and all across the country to organize these systems of care, because it's not just the emergency room or the hospital. It involves multiple emergency medical services. And so there was efforts on the national level to start programs similar to this.
And it has been successful. Do you have metrics to indicate the success of the program?
Yeah, actually, I feel very honored to work with this team that's been recognized by the American Heart Association. Not only the hospital has received awards from the American Heart Association as a hospital that performs the procedures, but the MidMichigan Health Emergency Medical Services recently received the Gold Award from the American Heart Association Mission Lifeline Program for this excellence in care, because we collect this data and we actually look at it within several days and we look at the timeline and see if there's anything we could do in each case to speed up the process, make it work more smoothly. And so it's a continual process of quality improvement. We then submit that data to the American Heart Association, and when the program first began in 2007, they were doing between 30 and 50 of these procedures in the setting of a heart attack. We do many more procedures for other reasons or less acute reasons. But for these STEMI programs, these worst heart attacks, it was 30 or 50, and I became involved. I came to town here about 4 years ago in 2012, and the program was already ramped up, and the education process for the paramedics was in place, and now we've grown it to the point where approximately 120 to 130 per year patients, and coming as far away as Houghton Lake, Denton Township, Roscommon, Mount Pleasant, Gratiot, and Alma are being transported directly in. And so we're very proud of all the members of our team, and they've done a very good job of meeting the goal, of the timeline goals of the American Heart Association. And our outcome data is part of what the hospital system was recently recognized as a top 50 cardiovascular hospital in the country. So we're very proud of that. And this is one small piece of our whole program.
Well, thank you, Doctor, for appearing on Community Focus. That's just kind of a wrap-up. We want our viewers to know if they have heart attack symptoms, call 911. Don't go anyplace on your own. Call 911 and let the EMTs take it from there. So thank you for bringing us up to date on the STEMI program.
Thank you very much.